My personal opinion about the case 39, a girl with Crohn's disease and pulmonary nodes, is its spontaneous drawn on the oval loose dam and see with the CT scan of T radiography. This case for more than half of a solitary pulmonary nodes are not cancerous, as a benign nodules have many causes, such as scars and past infection. Infection Infection of granulomas is caused most for benign lesions. Common infection that often results of a residual granulomas or other health scars include tuberculosis or being exposed to it. Fungi such as Aspergillus, Coccipitomology, Cryptococcus, and Hippothalamic. Primary lung cancer is the most common cause of pulmonary nose cancer. It is a cancer that starts in the young me. Thank you very much.
Initiate this inflammatory process by activating inflammatory T helper cells. Inflammatory T helper cells accelerate the inflammatory process through a number of mechanisms. For example, inflammatory T helper cells release pro-inflammatory cytokines, such as TNF-alpha. Recent research has shown that TNF-alpha is a major driver of the chronic relapsing inflammatory activity of Crohn's disease. TNF-alpha has multiple pro-inflammatory actions which it exerts by binding TNF receptors on various target cells, such as epithelial cells and macrophages. In summary, in Crohn's disease, uncontrolled inflammation is initiated by antigens normally present in the gut and ultimately results in an uncontrolled inflammatory response mediated by activated T helper cells and pro-inflammatory cytokines. One of most importance, TNF-alpha.
Infections, smoking, and taking antibiotics or anti-inflammatory drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs. One way that the body can protect against potential bacterial threats is with inflammation. We are familiar with how inflammation looks on the outside of the body. For example, when you have a scrape or a cut. That scrape or cut becomes red and inflamed as a result of the immune system trying to get rid of any bacteria and viruses that are in the wound. After a few days, when the immune system has finished its job, it turns off, so the redness and inflammation disappear. In Crohn's disease, inflammation, ulcers, appear within the GI tract, and the immune system works to combat the bacteria and viruses in the same way as with a cut on the surface of the skin. However, the difference is that the immune system is not able to turn itself off after it has gotten rid of the bacteria or virus, so the ulcers remain until they are treated with medicine or surgery. This chronic inflammation is what causes the symptoms of Crohn's disease. The symptoms of Crohn's disease vary depending on where the disease is located and its severity. This means that every patient with Crohn's disease experiences the disease differently. Most patients with Crohn's disease have abdominal pain and diarrhea. The GI tract can include abdominal tenderness, loss of appetite, weight loss, fever, fatigue, rectal bleeding, anal skin tags, and ulcers. In children, Crohn's disease may result in stunted growth and a failure to thrive. Symptoms are not present. In addition to symptoms involving the can affect other parts of the body.
Now, is Bryony Hopkins, who was herself diagnosed with Crohn's disease at the age of 4. Thank you very much for joining us.
Thank you.
So you obviously don't remember what it was like then.
Not much.
What was it, though, that led to your parents? You must know that, I guess. What led to them getting you tested? What was going on?
Well, I lost a lot of weight in quite a vast amount of time. I remember I was on holiday in Wales with my family. I was losing a lot of blood out of my back passage, which obviously is not ideal. I wasn't eating. I was very, very sick, and I think it was mostly the blood that my parents were like, I think we need to sort of go and see someone about this. And I went to the hospital. For about a year they thought it was IBD, and then when I was about 5 years old they said, no, we think this is Crohn's disease. And then from then on, throughout my whole childhood, it's been sort of plagued by the illness.
And tell us more then about the impact on your childhood.
Most of my childhood I was in and out of hospital on numerous medical treatments, sort of going from that would sort of make me blow out to the size of a hippo, and would sort of make me quite depressed and really bad mood swings, to mental diet, which is a liquid diet. So for 8 weeks I didn't have anything, I didn't eat anything, and I was fed through a nasogastric tube that went up my nose and into my stomach. And when it got really bad, because it was my large intestine that was the worst part that was affected, they decided to remove that when I was 13. So from the ages of 13 to 16 I had an ileostomy bag, which is when they sort of bring out your intestine to your stomach. And then I was lucky enough that sort of put me into remission, and once my large intestine was gone, that was kind of the main part of my disease that they'd got rid of, so they could rejoin it now, and I don't have a bag anymore. And but sort of my whole childhood was Crohn's.
But it's now under control.
Yeah, well, I mean, I am in remission, but I mean, remission is, a tenuous word for anyone who suffers with Crohn's. I mean, I still suffer from really bad fatigue, I still get pain every day, but to me that's normal, and I don't know any different. But
what have you been told about prone to it? Presumably at the age of 4, that's solely genetic factors. I mean, we're hearing that the numbers are increasing now, and it's dietary related in many cases, but that could
for me, I don't think. I think there hasn't been many sort of clear reasons why I particularly got it, but I think it is probably genetic related. As this research is coming out about junk food, I mean, I don't know much about the science, but I can't personally see how that would be related. I mean, I've got a really healthy diet. I had a really healthy diet when I was younger. I mean, my case is very unusual because I was so I don't know, it might be slightly different to, teenagers that are being diagnosed, which seems to be the trend nowadays. But I think also having a low immune system, antibiotics, and even if I get an infection, the doctors are very, very wary about putting me on antibiotics. My immune system is so low. So I think that's quite an interesting insight that's come out of this research.
And by putting out this research, I guess at least it gets people talking about it, so it raises awareness of it.
Yeah, I mean,
when no one knows what's going on with a little one especially, it must be very worrying.
I think one of the main things with Crohn's and colitis is that it's so embarrassing to talk about. I mean, no one wants to talk about those kind of in your life. No, people don't talk about that. It's quite a taboo subject, and I think the rise in young people being diagnosed, the awareness is out there. So if there's something wrong, people feel like they're brave enough to say something and get it checked out.
Has to continue beyond today, and that's why I encourage so many people out there to get involved one way or another. Of course, you can go to ccfa.org and find out how you can get involved, but also it involves contacting your legislators and making sure that they are on board with supporting so many people who are affected by Crohn's and colitis and inflammatory bowel disease. It takes a community to get action, and that's why I'm encouraging everyone to get involved. Contact, once again, ccfa.org to find out how you can get involved, and talk to your friends, talk to your neighbors, because I am sure if you don't think you know someone who is affected by this, it's just because you haven't found out yet. Trust me, there is someone you know who is dealing with this right now. So thank you for your support, and keep it